Thank you so much, Wes, for visiting us again. It's always a delight to have you here and see this amazing work that's been achieved. Thank you for the funds, which I know you've worked hard to secure for the hospices. And now you've been here, now the finished article is quite clear. What are your thoughts?
The loveliest thing about being here today is this amazing environment that is providing such an important service for people at the most delicate moments of people's lives, end of life. It's amazing, actually, and for me personally, it feels so good to think back to the decision we took in my office to release the biggest investment in capital investment in hospices for a generation. You know, I remember the conversation really clearly, agreeing it, and now I'm sat in it, the result of it. And it's nice on a personal level to see a decision that we've taken in government translate through to something amazing for families. And there'll be places like this right across the country, and I'm really proud of that. It's also really lovely for me to be here today because I've followed your journey. So from being sat in your office, listening to you talk about the ambition of what you wanted to achieve, coming back here last time in the middle of, this was a building site.
Yes.
And I was so impressed that while the building site was underway, the construction, you still had a functioning hospice through the barriers, all being done really sensitively. The construction team, the contractors working really sensitively with your team, the professionalism with which your team went about their work, all of the new community work in people's homes you were doing as a result, all that change. I mean, it's just been a really wonderful journey to see and be part of, and now we see the results of it. So I'm really proud, actually. I'm pleased for St Francis. I think it's obviously great for families, and I could see the pride that the staff have and the joy of working and caring for people in this beautiful environment. But I'm also conscious that this is the start. There is so much more that we need to do to support our hospice movement and to make sure that we have really high quality end of life care for everyone in every part of the country.
Thank you. That's a really encouraging message, and I know that you're personally very committed to the hospice sector and that access to good quality end-of-life experience and care is everybody's right. So I'm really encouraged by that. Thank you. You will have seen the Public Accounts Committee's report that came out this week with some very strong, serious and clear messages and recommendations for the government. You know, we discussed the modern service framework earlier and the fact that there is a need for a clear costed delivery plan. How are you and the government going to respond to those recommendations and act upon them?
Yeah, I take it really seriously, and what's, I think, really clear from your experience here at this hospice is that as well as providing really good quality end-of-life care for people, making sure that people don't just die well, but they live well as they approach end of life, it's really important for those people and their families first and foremost, but you're doing a great service with and for the NHS too. You were telling me about the 3,000 hospital admissions that your team has helped avoid because you provided the right care in the right place at the right time. And I think what you have proven, and the Public Accounts Committee in Parliament is also clear about, is that that's not just better for the patients and their families, most importantly, it's also better value for taxpayers' money. Because if those patients had ended up in hospital, they would have ended up there unnecessarily in an environment that is not as good and carries high risk in terms of things like infections and hospital-acquired infections. It's also much more expensive. So I think that the challenge, and actually frankly the pressure on me and the government, is to make sure that what we're saying we want to achieve with our 10-year plan for health, in terms of that shift from hospital to community, we are actually delivering with that shift from hospital to hospice, and also supporting hospices to provide not just care in beautiful spaces like this in a hospice, also to support your community teams as well in people's homes, making sure people have real choice about where and when care is provided. So I definitely feel that pressure, and I'm also acutely aware that while you would not be able to function and the hospice movement would not be able to function without the generosity of the British people,
Yes.
all of those fundraisers, the fund runs, the really generous gifts people leave as legacies after they die, we've also got to step up as the government. We've got to do more. So that's the challenge we're taking on. We have delivered big investments already through the hospice grant for buildings like this, the children's hospice grant over the next 3 years, but I also appreciate there's more for us to do, and that's certainly the challenge that I'm taking away from our conversation today.
Thank you, and we'll keep applying the pressure.
And you should.
Thank you.
Good.
Thanks very much, Wes.
Thank you.